Let's turn to the other big story tonight, where coronavirus continues to remain the big global issue and increasingly is coming home. Kerala has now declared a state calamity after a third case of coronavirus was confirmed today. Several Indian nationals remain stranded in China's Wuhan city, the epicenter of the corona outbreak. Gopi Krishnan has more.
The coronavirus scare in India is very real, as 3 cases have now been confirmed in the country. All 3 confirmed coronavirus cases are in Kerala. Students who returned to their hometown from epicenter Wuhan. All the 3 students have now been quarantined.
According to Kerala Health Minister K.K. Shailaja, all the hospitals in the state are fully equipped to handle even the worst cases in connection with the coronavirus. All government hospitals and medical colleges have been equipped with isolation wards, and many patients are already being monitored in these hospitals. The treatment protocol for the novel coronavirus have been briefed to the doctors and other paramedical staffs in the government and private hospitals in the state.
Another individual suspected to have symptoms of coronavirus has been admitted to a hospital in Karnataka's Hubli district. Over the weekend, over 600 Indians were rescued from Wuhan in China. But there are still several Indians in Wuhan who are appealing to the government to save them.
मतलब हम इंडियन गवर्नमेंट से सिर्फ इतना कहना चाहते हैं कि हमें भी यहाँ से निकालें। हमारे भी पेरेंट्स हैं, वो भी टेंशन में, हमें भी घर जाना चाहते हैं। बस तो हम इतना सिर्फ गवर्नमेंट को, इंडियन गवर्नमेंट को कहना चाहते हैं कि जल्द से जल्द जितना हो उतना हमें यहाँ से जल्दी बस शिफ्ट कर दे इंडिया।
Those who were rescued from Wuhan are now in an army isolation camp in Haryana's Manesar and are passing time in a fun way as they continue to stay quarantined. China, meanwhile, is struggling to control the spread of the deadly virus. The death toll in China has crossed 360 and over 17,000 people have been infected.
While the test results of more than 60 samples are still awaited from the National Institute of Virology, the state government hopes that they can contain this lethal virus without any casualties from Kerala. With camera person Tinku Rajshekharan, Gopi Krishnan in Thiruvananthapuram for India Today.
And I'm joined to understand what impact could be on India in terms of the medical fallout. Dr. S. Chatterjee, Senior Consultant at Indraprastha Apollo Hospital, joins me. Dr. Chatterjee, what's your sense? Do you believe that this could spread further, that this is extremely a critical situation? 3 cases so far detected in Kerala. Could it get much worse?
See, it is still not a critical situation, but the chance of it spreading to other parts of the country is high because we have people residing in China who are visiting this country, and China is a very popularly visited country. So there is a very high chance that it would come out of Kerala and come to different states, different cities. So we have to be very careful. The surveillance has to be very proper, and we have to be really careful. But the government, I think, and the way we are going about, the steps taken till now are all correct, but there is no doubt that the surveillance has to be very high.
What exactly is the nature of this virus? What is the nature of this virus?
See, it's basically a respiratory virus. It has earlier also caused problems, but since we at this moment we don't know, and they are all mutated viruses, we don't know exactly what is happening. What is the source of the infection? We have no drugs to treat it till now. There have been a few studies which have told that, okay, 1 or 2 patients have been treated in different countries with a group of drugs, but there is no definite answer to the treatment. Since we don't know much about the virus as of today, and also the virus mutates very fast, and we don't have a definite treatment plan, that is where the problem lies. So we need to be very careful. We need to be very careful in the next couple of days as to how it evolves. The entire world needs to be working on it because it's like a global emergency as of right now. So as things evolve, as things change every day, we have to be careful and we have to follow the footsteps, have our own treatment modalities, and we have to be very careful.
What are those treatment modalities? What should a person who may, what are the treatment modalities? What are the symptoms?
See, the main symptoms are cough, sore throat, runny nose, and fever. But if it progresses, then breathlessness is obviously one of the symptoms, and on a radiological examination, you can have pneumonia once the disease has progressed. There are a few reports which are coming in that diarrhea could also be a manifestation, but not necessarily right now. It's mainly, as of today, a respiratory virus causing cough, sore throat, breathlessness later on, and fever as the major manifestation.
And what's the precaution for now? Is it purely only through contact with people who are coming in from China?
Obviously, because that is the most common, that's the epicenter of the disease. So anybody coming from China or from even different countries, because other countries have also reported it, people even coming from Hong Kong, a few people coming from Thailand, even there has had a death reported in Philippines now. So we have to be careful. Once they come into the country, we have to have a proper surveillance going on at the different entry points. Once it is there, and for the general public, what is there, anybody who is suffering from a sore throat, cough, fever has to be careful so that we don't spread the infection to others. And in any suspected case, they have to be they have to report to the government directed agency where they have to be tested, and depending on the need, may be quarantined at home. It's not necessarily that they have to be quarantined at different specific centers, but they can even be quarantined at home, and they should not be in contact even with their family members. That's the thing which is evolving as of right now.
Dr. Chatterjee, of course, these are early days and we still don't know just how widespread this outbreak really will be and what will need to be done in the days ahead. But for now, precautions are being taken in different parts of the country. Appreciate Dr. Chatterjee, you're joining us. We will continue to track the coronavirus. Let's leave you though with our image of the day. While politicians are busy shadow boxing with their opponents all the time, take a look tonight at Tamil Nadu's Fisheries Minister D. Jaikumar, who entered the boxing ring himself to throw a couple of punches. What would we do without our netas? Thanks for watching. Bye for now.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.